Welcome to Safety and Health Week 2022. I'd like to begin by acknowledging that CCUHS is situated on the traditional territory of the Haudenosaunee and Anishinaabeg, on territory covered by the Upper Canada Treaties within lands protected by the Dish with One Spoon Wampum Agreement. In the agreement, the dish represents the territory, and a single spoon represents that the people are to share the resources of the land, taking only what they need. We also acknowledge that the legacy of colonialism continues to impact Indigenous people today. We commit to seeking a new relationship with the original peoples of this land, one grounded in honor and deep respect. I'm Sue Freeman, Outreach Program Manager within the Communications Department here at CCUHS. And our speakers today are Stacey Maguire and Travis Woodworth. Stacey Maguire is the Senior Health and Safety Manager at Glooscap Ventures, a proud Mi'kmaq woman from Glooscap First Nation near Hantsport, Nova Scotia. Stacey was the 13th person in Canada and the first Mi'kmaq to be certified as a Canadian Registered Safety Technician. Her accolades include a feature in Canadian Occupational Safety and an award for outstanding service to the Canadian Society of Safety Engineers Atlantic Region. Travis Woodworth is Glooscap Ventures Health and Safety Coordinator. Travis is a band member of Millbrook First Nation near Truro, Nova Scotia, and a graduate of the Occupational Health and Safety Program at NSCC. Travis is passionate about creating engaging training for frontline employees that gets them on board with workplace safety. Welcome to you both. Stacey, we invite you to share your local land acknowledgement.
Thank you, Sue. Gway and Epichalasi, hello and welcome. We would like to recognize the lands that we are presenting from, Travis and I are presenting from today, are the unceded and ancestral lands of the Mi'kmaq Nation known as Mi'kma'ki. I invite all attendees to reflect as we commit ourselves to gaining knowledge, understanding, forging a new relationship, a culturally safe relationship, and contributing to reconciliation. Mulawin.
Well, thank you, Stacey. Today we will be discussing workplace health and safety in Indigenous communities, the complexities of situations workers in small rural communities may face, and the value of integrating culture into safety programs to gain acceptance from communities. To start, Stacey, as a generalist in health and safety, can you help us understand more about what happens in your First Nations communities and the impacts those situations may have on First Nations workplace environments?
So I just want to set the stage a little bit with First Nation communities. So across the country, First Nation communities look differently. Some are smaller, bigger, they're in different landscapes, different access to different locations. And within most First Nations, there's usually a variety of workplaces. Now, this always depends on the size of the First Nation, the location, and a variety of other factors. So in Nova Scotia, we are the Mi'kmaq Nation, and also throughout Mi'kma'ki, so outside of Nova Scotia in other Atlantic provinces as well. But in Nova Scotia, we have 13 Mi'kmaq communities. And the one that we are coming from today is called Glooscap First Nation, which is my home community. So here in this community, there are about 6 or 7 different workplaces. And most of the employees know each other. They're related, they're neighbors, they know each other from when they were small, they live in the general area here. So that can be similar to family-run businesses, small businesses in rural settings. So, it could be relatable to other people as well in safety. So this really creates interesting dynamics, both positive and challenging. It does create a sense of community for us and it really does, I find, naturally reinforce the internal responsibility system and those principles, because we really are concerned about other people's safety due to these family connections and ties. We also look at safety outside the workplace more often due to this community lens. So we're not necessarily only looking at what's happening inside the office or inside the gas station. We're also concerned about playgrounds, sidewalk safety, senior safety, bike safety, because these are, again, our family. The people who are working in our communities these may be their parents, their neighbors, their children, and what happens to them if there's an injury in the family, even if it doesn't happen in the workplace, it still brings that effect into the workplace as well. So we do have that community aspect. Jurisdiction is also a really interesting topic in the First Nation community. So are we federally regulated workplaces? Are we provincially regulated workplaces? And the answer is both. It really depends. Here in Nova Scotia, I will say, it depends on the workplace. It depends on the activities within the workplace. So what we've decided and what our approach here in Glooscap First Nation is that we take the regulations as minimum standards, both federally and provincially. We look at which is higher, and we still use that as a minimum. So we either go to that standard or above for all of our standards. So we cover everything. So we really try to not take that too much into consideration, but it's always there and it's always a question. And then lastly, from a health and safety practitioner standpoint, working in an Indigenous community means that we wear several hats. We're in all of the workplaces. So we could be at the health center, we could be in an office, we could be at a gas station, we could be on a fishing boat, we could be at a seafood processing plant. So it does mean that we do have to be generalists, and it's very interesting. It's lots of variety, but it does mean that we do have to stay in that generalist aspect. Hope that gives you some information about how it is in the Indigenous communities.
Well, it sure did. And I'm thinking of words like you're not only carriers of tremendous amounts of knowledge, you're also purveyors, and that you need to get the word back out in a community-based fashion, not just at a workplace level, and so many different variables to consider. So moving into that, I'm going to address Travis next. And in terms of work-life overlap with coworkers, employees, managers, and the clients that you provide services to, Travis, what role does health and safety have in an Indigenous community from your viewpoint?
From my viewpoint as a practitioner looking to bring safety to a formal level here within communities, we're starting to address the people themselves, the frontline staff, those who are actually performing the activities. So as someone who's trying to bring regulation to that, following the strictest rules, I kind of realized that we can't follow the strictest rules. We cannot just simply sit there and say, this is what we need to do it. We need to sit down and find out where the frontline workers, where the employees, where the community members are sitting at this moment, and try to bring everyone together towards these safety regulations, towards compliance. For me, what that means is speaking to the individuals, finding their stories, finding their experience, and finding their pain points. I use this term quite a bit, pain points, because it's a very effective tool of building rapport and commonality. Now, I've worked a lot of frontline positions myself, and I've also had the education behind occupational health and safety. And when I try to cite legislation, everyone's eyes glaze over, including my own. So what I do is I find out what the frontline has done, what made them frustrated in the past, what dangers have they encountered in the past, and what have they accepted in the past. I find out their risk assessment methodology, and speaking to Stacey's point where everyone knows each other, our risk assessment is a small community style. I know Frank my entire life. I knew him for 30 years. He likes to take risks. His risk appetite is pretty high. There's some complacency behind that. As I know Frank, I might turn a blind eye to some of those risks, whereas in a mainstream place of employment, I might pull the rules down onto them. For me, speaking about that pain, speaking about the injury, and then bringing the community and family aspect into it really lends itself to compliance. The reason is, it's no longer Frank, whose risk appetite's higher. He's no longer the primary consideration. His family is, the community is. We've seen massive success in both small communities and the fishing industry here, which is a very thorny industry to get safety into. There's a lot of hesitation, a lot of resistance. But by bringing the reason of being safe into the picture, we change the dynamic. We change it from, oh, I'm tough, I'm rough, I can do this, I've done this for 30 years. We change it from that to, my family needs me to come home. They need me to continue working, producing that money, paying the bills, and being full for them, both in mind and body. And that's where safety really has a foothold within smaller communities and Indigenous communities. How does that change my approach? Well, like I said, I can't cite legislation. I will when it's required, absolutely. And there's absolutely the hard discipline side of things. But if I want effective change, I have to speak to the person and address those pain points. And then most importantly, allow them to tell me what they think is effective. By having that open communication that goes both ways, we get buy-in. Now, it's not a perfect system. It's something I'm still growing and developing. And I'm not the only person who still have this. But I'm just, I'm noticing that it's a hell of a lot more effective. And I really enjoy those conversations with these people because you learn so much and you get so many different perspectives. Focusing on that personal is so essential. Now, when we move into issues where compliance is hard and difficult, we have to be careful of how we do discipline and how we move, because the community aspect means that information gets to everybody. So that's one of the downsides I find with working with smaller communities, that your neighbor's going to know before probably the person who you're looking to bring some sort of compliance issues with. It's a tricky subject. I wish I had all the answers, but I don't, and we're working towards it. And I hope that helps.
Oh, it surely does. No, thank you, Travis. That was very well explained. And I wondered if, Stacey, did you have some follow-up to that?
I think just to stress again, the fact that we know people on a personal level really does, it does help us, because we know they're wise. We can, talk about their family, talk about, oh, well, little Jimmy wants you to be home and playing ball with them on the lawn on the weekend and things like that, and reminding them of it's, you're doing this and you're doing things safely for other reasons. But one interesting thing, it is challenging too, because some of these people have known you since you were a little kid. You were the kid on the lawn playing ball or whatever as a teenager. And so it does bring those challenges in when they don't always see you as the safety professional. They see you as so-and-so's kid or so-and-so's grandkid or whatever. So that's always challenging, but it can really lead to great rapport with people and bringing those whys out for sure. So.
Well, thanks, Stacey. That even lent more depth to it as well between yourself and Travis. Very well explained. And what was jumping out at me, Travis was talking about risk assessment and risk tolerance among individuals and community, and how there's this more community consciousness that you're trying to build around health and safety versus individually. So those are some takeaways that I'm having from our talk today. So right into that, Stacey, we'll continue on. Can you share some examples of health and safety community partnerships that you've created and the need to have a broader community-based safety approach?
Yeah, absolutely. We have a couple on the go now. Our workplace health and safety committee, or our JOSH committee, we've decided, because of our workplaces are smaller, there's not a regulated requirement to have a JOSH committee in each of the workplaces, but we really see the value in that, and the sharing and the learning approaches that bringing people together really have. So what we've done here is that we've taken those 6 workplaces and brought people in, a management and employee, or sometimes just a couple employees from all of those locations. And this really gives different perspectives when you're talking about issues that are coming up, or some hazards, or an incident that happened. It does give those perspectives and different perspectives and different experiences. So as an example, we had an incident at a workplace that had a counter. The counter moved up, and that's how you came from behind the counter. And this counter was up against the wall, and an employee was going through, and the counter came and hit her on the head. So we wanted to make sure that didn't happen again, and how could we do that? And we began talking about it. And what they initially did is they just took that counter piece off and said, nope, so there you go. There's the elimination right off the top, and that's not going to happen again. But when you look at that after, what it did was it eliminated that counter space. So it did bring up other things, and when you do put in a control, you do have to look at those and assess afterwards on, did it bring up other hazards? How does this affect other things? And there was no place for employees to put, like, it was at a Greco, so there was no place to put your pizzas for when people were coming and paying and that kind of thing. So they were thinking about all kinds of different ways. Are we going to put something up with a latch? Well, now we have to have somebody make sure that we're going to latch it. Do we have automatic latches? And it was in one of these meetings where we had people together that an employee from another location, they weren't a Greco, but they were a store that had a counter. Their counter comes up from the bottom, and something is slid underneath so that the counter stays, level with the other piece of counter. And so there's never a chance that the counter will fall down, because it only goes down, not up. And those things are really powerful. I mean, that's just a small, simple example, but to have those people from different workplaces or different perspectives come together and give those experiences, we find that really, really powerful again. The other part that the other partnership, that we have put together is a project called Spirit of the Wolf. And this is really a project, it's an Atlantic project that we work with the health centers throughout the Atlantic Canada, the Indigenous health centers. And this is, really a community approach around pooling our resources. We don't have enough resources within a single workplace or within a single community to have a health and safety position. So what we've done is we've pooled the resources, and we help to develop programs and implement those, and do some coaching with. There's actually 33 Indigenous health centers within the Atlantic. So we have found great success in that. and it's just collaborating and finding those solutions and finding a way to get these things done and back to that community approach.
Thank you, Stacey. That was really very intriguing when you say the breadth of workplaces, the number, the types, and how all that's being considered in your approach. So over to Travis again, in terms of being a practitioner and some of what Stacey's describing, could we hear some of your experiences as well, please?
My experience is I'm new to this as a practitioner, and it's exciting because I'm also an outsider to this community. I'm from outside Glooscap, and it gives me a unique perspective. Whereas I don't know everybody, I don't know their families, and sometimes I'm seen as a new source for conversation with employees. It's really great for me because it helps me build that rapport, and we get to discuss stories and have those really frank discussions when it comes to safety. I can use stories that they never heard of, and they can tell me things, and it's just a really good time. But it's also important because it allows us to develop our baselines of how we want to operate, how safe we already are, what's our ingrained sense of workplace safety, operational safety, and IRS. So how we keep an eye out for each other. For me, moving forward, how do I formalize this? How do I take these organic conversations and relations and turn them into something that can be passed on and continuously improved upon? This is very exciting for me because the way I operate, it's not me sitting down at a whiteboard, putting down a plan and writing a program or a policy. It's about having those conversations to a different level, asking them for their input and making sure their input is appropriately listened to and, if effective, implemented. This, I don't know, when you see someone whose idea is listened to and then implemented, the buy-in is tremendous. They become like immediately, like, I can't explain it. They take pride and ownership over that idea and that process and program, and it's strong, and then it leads to others seeing that. There's a cascade moment where others see, oh, they're being listened to, and safety becomes this concept that is immediately ingrained into the employees. I don't know how to explain this one. It's new to me. Like I said, I'm new and I'm learning all this. But how I take that and move it to a grander scale from one employee, from a handful of employees to more, I don't believe I do that. I believe if you have the buy-in and you focus on the community aspects of small communities and Indigenous communities, they sell it to themselves. They start preaching safety to each other. And if you give them a forum to actually be heard and actually work with their ideas, they do that even more so. That continuous improvement becomes something that I no longer have to do, but we all do. For me, this just means small communities, Indigenous communities, a bottom-up approach is the way to go. It's, like I said, I'm new, but I found it be the most effective thus far.
Well, thanks, Travis. I know in conversations we've even had prior to today, there's been some great learnings I've taken away too. Like you say, when you invest yourself in a new situation and the people that you're working with are open to learn and change, and they become their own safety champions, and that you support them in that. And then you support the community because each of these individuals are the community at large, right? And they're speaking to each other. They're having this important dialogue about care, a duty of care. You talked about IRS, the internal responsibility system, and that's of the community in what you're describing, and creating a really healthy spread of positivity and practice. So it's as you put it, it's exciting. You're coming from away and bringing the goodness in, but also harvesting what's happening there and the work that Stacey herself has been doing and employing that among them, giving them agency to be safe, health, and want. I remember our conversation where you said that they want to be, not that they're being told, but they want to be healthy, safe, and well as both individuals and a community. So back onto yourself, Travis, in terms of what learnings from all this can you give to people outside of Indigenous communities that would likely improve their health and safety practices in the workplace, especially ideas when we think of other small rural communities, what can they benefit from as well?
Sorry, there's a siren in the background. The reliance on legislation and any sort of programs is going to fail in smaller communities and be less effective in larger organizations and industries unless you have that frontline engagement. So by focusing on that frontline by the individuals and speaking to them and getting those ideas and bringing them forward, you're kind of missing a whole piece of the puzzle. Like Stacey said, when we spoke about that counter, the buy-in was tremendous because it was their own idea. It wasn't me or Stacey saying you must do this. They wanted to do that, they did it, and they felt proud of that. Now we get to sit here, me and her get to attribute that to safety. And hopefully they start thinking about other things that way. So by just raising that awareness and allowing them to fix it, they start to look at other things as well and bring more ideas here. If I provide a safe forum for them to report to, I get all those ideas. And that's why I would recommend to any other organization looking to embolden their safety programs in smaller communities. Listen to the employees, give them a safe place to come speak to you, air their grievances or complaints, and really listen to them. Present a little of yourself in there, and they'll present a little of themselves in there, and the rapport will be great. And I think the results you'll find excellent.
Thank you very much, Travis. So back over to Stacey and your thoughts around learnings you can give to people outside of Indigenous communities.
I would have to echo a lot of what Travis has said. I mean, the community approach, collaboration, and just really listening to people. People want to be heard. People have great ideas. The safety professionals have not done every single job that is every task in the workplace. People know their jobs. They have great ideas and they love to be heard. They love to be asked. You need to create that environment, that positive environment that allows them. I think Travis and I were talking earlier, what did he say? Provide space, give space to that. So that people have that time and opportunity to give their input because they have great ideas. And it's not, it's the approach in that you take. We have a community that we're working with that had previously had safety programs developed, and they had a safety person, and their approach was to tell them how to do things and to be very punitive and give those reprimands and things for not doing what they're supposed to do instead of being educational and informative and that kind of approach. And now here we are years later being asked to come in and do the same thing because it didn't take. It was an approach that worked. I'm sure a lot of family-run businesses, small businesses, especially in Indigenous communities, we don't like being told what to do. We like to be considered and be asked what we think. And so why would it be any different with our employees? We want to be able to give them a voice and doing what I say because I said so. It doesn't work. So yeah, basically collaboration, community approach, discussion, all of that stuff is so worthwhile, and finding out building those relationships and finding out the people's whys and finding out about themselves, all of that stuff, it takes a little extra time, but it is so worth it because they really do take that ownership on, and it's the exponential growth that you're looking for. And to be able to you tell two people and they tell two people and they tell two people, and it just in the end makes everything easier and everybody happier, for sure.
Oh, it's a very important set of messages that you've shared, both of you, Travis and Stacey, today, and some things I'd like to reflect back, both yourselves and our audience today, is the importance of safety culture. I heard that loud and clear today, that we could really see how the development, like you say, takes more time, takes more effort, but that investment in really understanding, listening actively, and then internalizing, and then helping other people internalize and take action has paid off in dividends, right? That the things that you're trying to establish as a playbook, not from a top down, but more from an organic conversational buy-in, it's really made a big difference. So I'm just excited about the examples that you shared today because they're very tangible, they're very real. I can imagine I've seen Statistics Canada produce things over the years, an average of 1.2 million small and medium-sized enterprises in this land that we call Canada. And that's a tremendous amount of workplaces that could be influenced by some of your practices and ideas today. So it was important, this discussion, and from that, we're starting to see actual questions pop in a couple different places. So I have some screens set up here, so don't mind me looking around because we've got some real interesting things to share from our audience. And Mike is asking a really great question. And here we go. So either Stacey, Travis, whoever just wants to jump in, and someone else could finish up on it too. And Mike's asking, are you able to incorporate traditional knowledge within your occupational health and safety activities, for example, job hazard assessments? If so, what are the challenges both within the community and the provincial federal legislation? So it's a fascinating question, really, and it's a bit multifold. So who would like to have a go? Stacey, did you want to start? And we'll get Travis to jump in. Okay, go ahead.
Yeah, sure. Thanks for the question. And I think that it's important to know that for us here in the East, and I never want to speak for all Indigenous people, all First Nation people, let alone all Mi'kmaq people. But here in the East, our traditional knowledge is not as prevalent as some, even from Ontario going west. We've lost our cultures and traditions a long time ago, and we're struggling to get those back. So as we learn as a community and as a people to revitalize those things, we are starting to bring those and put those into some of our forms, some of our processes, all of that. And it may just start with an image. It may start with words in our culture. But because of colonialism and residential school and many things that have happened in history, here we don't have as much traditional knowledge as we would like, but definitely that is something we're working towards, and we would love to have. So we would just love to have it all be in Mi'kmaq and use all of our traditional knowledge. We're just not there yet, but hopefully we can. But I think that the knowledge and the traditions that are there are really deep rooted in the fact of how much we do care for each other as a community. And that really brings us together in a way that is natural and it comes through in our approaches, and it comes through in our setups of things, but not necessarily as a specific culture or a specific tradition, I would say, or a specific ceremony or anything like that.
Travis, from your perspective and your First Nation, has some of this as well, and thank you, Stacey, pardon me, excellent. Some of the perspectives that Stacey is sharing, is that consistent? Is it different? We're just curious as an audience.
Absolutely. So my background prior to safety, I worked as a trade navigator with the Native Council of Nova Scotia, and we focused on assisting and providing services to those who without a normative status card, so not associated with any Indigenous bands within Nova Scotia, or who are status community but non-community members. They're off reserve, and so we mirror this exactly to the same point. We're still refining our culture, so it's really hard to blend a culture that you're still remaking into a strict structure like occupational health and safety. We still have to make sure we're doing things like our risk assessments, task inventories, that we're adhering to the minimums of the province and exceeding that, building that buffer. So at this point, trying to blend a culture that we don't have a strong cemented foundation in with a less than cemented formal safety is not something I'm willing to approach right at this moment. I focus more on, like Stacey said, our performative methods, speaking to frontline, speaking to the community, ensuring that there's back and forth conversation. I believe right now that's the most appropriate approach. I may be wrong. Like Stacey, I don't speak for everyone here, and someone else may have a better method. But from my perspective, it's we blend it the best we can. It's just not at a suitable situation right now.
Well, thank you both for your honesty, because today's chat that we're having, this discussion, is about where things are at. Mm-hmm. And then also future state, we're talking about at the same time, really, what can possibly be. So that's important for people who, whether they be in Indigenous communities or not, and they're running these operations, to keep that flexibility in mind, that positivity around the change is inevitable, and that you're going to work with what the best of things are to your benefit, right? And as things evolve, like you say, culturally, see where they most logically and reasonably work. So I'm getting all that as takeaway myself. And we continue on with some really interesting questions today from the chat. How would you bring issues with preventive measures, regulations, non-compliances, etc., when in some contexts it would be seen as overkill, when the community itself has difficulty to have the proper funding for more basic needs? So it sounds like a needs assessment, sounds like prioritization. I wonder if I could trace it back to yourself, Stacey, about that. Maybe how do you deal with that? Making choices around what do you do first, or more intensely around health and safety.
Yeah, great question. So a couple of things come to mind. For us here in Glooscap First Nation, we're quite a progressive First Nation, I would call us. And because we ventured into economic development, and we do have our sights set on becoming self-sustaining through economic development means, one of the things, because of that growth and development, we wanted to focus on health and safety. But health and safety does cost money. There's no doubt about it. Does it save money? Do you get your return on investment? Yes, absolutely. But there has to be that initial investment at the beginning. And for us, what we have done here in our community is we have a health and safety department, and we're actually under the Glooscap Ventures, the Economic Development Corporation. So we have a dual focus. We provide and we create and develop all of the health and safety programs and implementation for our community. but we also offer our services outside the community. It may be to another First Nation community, it may be to non-Indigenous communities, partners and businesses, and we bring that revenue into our community. And this year we have, we brought enough revenue in, we paid our salaries, we paid our expenses, and we had enough money to give back to the community as well. And that really helps us out with programs and services in other areas where there is some funding issues and not enough to go around, kind of thing. So that's the approach that we have taken here. But again, going back to the Spirit of the Wolf program, where we're pooling resources. So we would help other First Nation communities, or we would say put our efforts in to provide to many people instead of just staying here within our community. So I hope that answers the question.
Well, wonderful examples once again of some very tough decisions that have to be made so that you can realize some outcomes, right? So as I'm getting different sources of some amazing questions, I'm going to prioritize today. I think we'll take one more before we wrap up. And this is from Karen, who asked a very unique question in the question and answer window. I'm a regulator who, by design of my role, is expected to assess compliance and take corrective actions where needed. Do you have any best practices that might help make those initial inroads while you begin building rapport and trust? So I'm going to pass that over to Travis, because he was talking a lot about his approach, specifically as a practitioner and communication. Travis, take it away.
I'm going to echo myself here, speaking with everyone. I mean, everybody, just speaking to them, having candid conversations. And like Stacey says, this takes time, but the benefits are worth it. I'm not sure of your circumstances specifically, or how strict or the culture there is. I've worked in several, and I find within this community here in my own Millbrook, by being able to have those kind of conversations with people you kind of know, or at least have some sort of similarities and commonalities with, you find out not only about the person, but the position they're doing. And this leads to showing you, again, the baseline, where they're at, what they're doing, and how they're improving, any issues they see or are committing at that time. And then you can kind of identify those deficiencies. And as long as you're not going super hard on discipline or remediation, you can get them to buy in and solving those deficiencies, especially if they're just not aware that that is in fact a deficiency. There's an educational piece there. And that's, again, I have to echo myself, speak to them, find out about them, kind of be a little sneaky about it in the way that you learn about their jobs as well as the person, and then identify deficiencies from those conversations. That would be my best practice. Again, new, and but it seems to be working so far. And again, it's going to change depending on your workplace.
And I'd like to add to that.
Please go ahead. Go ahead,
Yeah,
Stacey.
I think one of the reasons why Travis and I work so well together is because he really focuses on the frontline workers, and I can see exactly from this answer of looking at that and talking to the people. But I want to give a kind of a bigger picture answer, because in order to get to those conversations with the frontline workers, I think anybody coming into a First Nation organization needs to approach the community in the proper way. So stopping by the band office to introduce yourself, letting people know you're in the community, or even before that, even before you have to be in the community, be in the community. There is a long history for lots of reasons why Indigenous communities don't trust people, don't trust government officials, don't trust people in authorities. So in order to build those relationships, back to what we had said before, you need to put in the time. And the time is building those relationships, building the rapport, building the trust. But that doesn't start on the day that you come in to give a fine or write somebody up or whatever it is. It starts long before that, when you're in the community, introducing yourself to chief and council, introducing yourself around the community, stopping in at, when we have community celebrations, usually depending on specifics, but usually everybody is welcome. The outside community is welcome. If you're wanting to work with a particular community, find out what's going on in their community. Attend the ball games, attend the powwows, you know, stop in to help with community projects. And the other part is that take yourself out of being the, I can't think of the right word, but put yourself in the education side of things. You want to come in and educate people. Why do you want, what's your goal? What is the end goal? The end goal is always to have people work safer in the communities. How are you going to do that? Look at the approach that we had from this other community who had a health and safety person come in and say, this is the way you do it. And this is why, because I said so. How did that work out? It didn't. So you need to know about your having a good approach, having the collaborative approach, listening to people. I mean, it's just being respectful, and it's not being respectful to necessarily an Indigenous person. It's being respectful to human beings. And I think that goes a long way. And if people see that you're there to help them and not to penalize them, that is an immense thing that you that will take you far, very far, and you'll get the return that you're looking for, I think.
Thank you ever so much. And you know, we are just at time today, and it's just flown 45 plus minutes. And I know it would, because we had a great chat even in preparing. So I want to thank you both. This has just been very powerful for me personally, and I imagine the audience, from some of the feedback we're seeing come through, much feel the same way. So thank you everybody for attending today's session and also participating. We hope that the information shared will assist you in making positive changes within your workplace. So we'd like you to take a few minutes to fill out the survey that you'll see. It's a short survey. It's going to open in a new tab once the event has concluded. Just really want to thank again Stacey and Travis for everything that they brought in terms of their wisdom and their experience to us today. And if you want to look for the remainder of CCHS Safety and Health Week, our virtual events, and a lot of parallels between this conversation, I imagine, on Friday for the Don't Walk By, with Leon Lyon-Bartley and Janet Manella coming up. They're going to talk as safety practitioners, as well as a concept around taking action when you find things. So that should be an interesting parallel we shall see. So if you do have additional health and safety questions, please visit our OSH Answers fact sheets or send a question to our free confidential safety info line, and links to those will be shared in the chat. Again, thank you everyone for attending Safety and Health Week. Please stay safe and well. Bye for now.